else?
I mean, we have certainly partnered with HRSA on a number of projects, and you know, ARC has the advantage or the disadvantage of we don't regulate care, we don't pay for care, we're the science partner, and a lot of our partnerships are in the private sector with whether it's Kaiser, WellPoint, United Healthcare, whether it's you know, the Marshfield Clinic. I mean, we have a lot of partnerships and a lot of connections in the private sector delivery system. And so partnering with HRSA, who has a large network on the public side, would really bring in a lot of patients.
Can I just ask one follow-up question, Deborah? You know, it's interesting. Over the last 2 years, I've noticed that you have kind of said at different meetings that these are opportunities that could be actualized. And you've said that more than once, and I believe that these are opportunities. Can you give me a sense as to why they don't happen?
Well, it keeps going back to the same question, and it's the question of the diagnosis, the guidelines, and what exactly we would be implementing. So as I said, there need to be some background work that would help to frame the involvement. In addition, you know, as a matter of fact, before I came, I did inquire of our community health center program just to affirm for me that in fact there was interest, and there is always interest in this issue of primary care behavioral health integration is a big area of interest right now for those programs. So there is interest in assisting and in helping to identify how those guidelines actually play out in actual practice. But once again, the question keeps coming back to what guidelines are we in fact being directed to?
Who would sponsor, if we wanted to hand you the guidelines, if you wanted to call together a group of experts to develop the guidelines? I know Fred's here, and we've been talking about this in the IACFS. We'd like to develop guidelines through the structure of the professional organization. Is there some collaborative way we could pull together the guidelines so that we could move forward? Because we have been talking about it a lot, but we have never gotten to that point where we could help you with what you need and have some structure to help us develop what we need.
So as stated before in other meetings, we're not actually a guideline developing body, but I will defer that to my colleagues who are.
Well, you may know ARC had a near-death experience because of our low back pain guideline. So
and I missed that.
I mean, I think in the case of chronic fatigue syndrome, we're really looking at getting information about patients, what kind of treatments are working, and I'm not sure if I would focus as much on a guideline per se, but rather various treatment options, how they work. And I certainly can put you all in touch with folks in our agency that work with these clinical networks, clinical research networks, to see what kind of possibilities there might be.
This is a structural question, and I mean, here's an opportunity. You know, Art keeps asking, you know, what can we do, you know, to really satisfy the needs of agencies, and here's an agency that really is open to having something satisfied, which I think is fantastic. I mean, maybe we should be thinking about, you know, one of our subcommittees really kind of focusing on this. This probably is going to take a while to work out. It's not going to be something that's going to happen at this meeting. And maybe if one of our groups could really tackle this, stay with it, keep in conversation, and work on this, this is really potentially something that's meets a need and is accomplishable. And I think it's. I mean, if I were to put this on our list, I would say this should be one of the priorities we should do.
It has enormous potential, and we're not going to realize that potential in this venue. Yeah. So certainly I'll accept that, Lenny. One suggestion that Dr. Jones has passed to me that on the face of it looks to be relatively inexpensive and therefore has some chance of going through, but might be the first step towards getting some of the more expensive goals achieved, and she suggested that we ask the Secretary to recognise special challenges of ensuring chronic fatigue syndrome as part of any efforts to train/educate providers under health reform. So that seems to me a relatively easy thing for the Undersecretary or the Secretary to do, and it provides an opening for a lot of other potential gains.
Recommendation then?
Did you want to move that as a recommendation, Chris?
I'm not sure I can do that as the chair. I'm usurping my role, but
So moved by Galen, and I second it.
further discussion.
I think it's a very interesting way to go. I like that because right now it's a very timely, it's the right time to insert the needs of this population into the healthcare debate. And,
It
reform.
frames it in a way that
Yeah.
is easy for people to swallow, I think.
I think that's very good.
All those in favour? Against? Abstentions? So moved.
Did Galen have a modification, though, or was Galen going to actually suggest a?
No, I thought the way it was written made perfect sense.
Chris, read it out loud again.
So, Chronic Fatigue Advisory Committee recommend to the Secretary that he recognise special challenges of ensuring chronic fatigue syndrome is part of any efforts to train or educate providers under healthcare reform.
Can you help us maybe also understand what are some of the implications of that? Just, I mean, how that might translate. I'm just wondering if either of you might give us your thoughts.
My thought is that once you get it recognised at that level, it starts to move up the priority list for everybody